Everard. I'm Emeritus Professor of Paediatric Respiratory Medicine. I've been working with children who have respiratory disease for over 30 years. I was a consultant at Sheffield Children's Hospital and an honorary professor at Sheffield University. And the last 7 years of my career I moved to Perth, where I worked at the University of Western Australia and Perth Children's Hospital. The core technology involves a naturally produced compound that seems to be extremely effective against biofilms. This would permit us to treat a variety of chronic infections and allow antibiotics that are failing to work to start working again. The initial application of this technology is likely to be in respiratory disease, where biofilms are really important in conditions such as cystic fibrosis, bronchiectasis, chronic bronchitis and COPD. And in that context, managing infection of the airways has proved to be extremely difficult over the decades and requires a novel approach. One of the great frustrations in cystic fibrosis and other conditions is that as the disease progresses, it becomes virtually impossible to eradicate some of these bacteria, which go on to cause such severe damage and in many cases death. One of the elephants in the room in respiratory medicine is the fact that chronic bronchitis, that is a chronic infection of the airways, is present in so many patients. When antibiotics were first devised, it was thought this would transform respiratory health. But we soon realized that relatively short course of antibiotics was not clearing the airways and not improving the well-being of people. If we can find ways of treating those infections effectively and restore lung health, this will have a vast impact worldwide.